Okay, let's get some truth out here about this coronavirus and everything. There's a lot of welcome to Palm Sunday edition of Mr. Christian's videos. It's really important for us to look at the details of what this thing is and what it's doing. There are a lot of people out there, a whole lot of people, that are posing as nurses and doctors, yet they're not giving any names, any credentials, anything. Oh, my eyes are dying this morning. Woo. Nothing. And you're looking in the background of where they're filming their little rants about how this is all fake and the coronavirus isn't real, yet there's a patent for it in the patent office, so I don't know how you can say it's not real when we know it's been developed. There's a facility in Wuhan that was making it, and supposedly it got loose from there. It was a bioweapons lab, because this is a bioweapon. But you've got people that they're not dressed like healthcare workers, they don't carry themselves like healthcare workers. I know a few doctors personally, and there's a video floating around, there are several of them actually, I'm a surgeon, and I don't think this is what it is, this and that and the other. They make it sound really good, but then you look at the apartment they're sitting in the background, it's like, I don't know any doctors that live in apartments that small. So you've got to, and they look sterilized, like somebody cleaned everything off the counters, no signs, no paper stuck up, no nothing. It looks like somebody's never lived in there. You've got to look at the details, and you've got to pay attention, and you've got to do your own research. I spend a lot of time doing research now because there's so much misinformation out there. Coronavirus does not kill you. It's the secondary infections that kill you. Now, if you do a Google search, or in this case I did a Bing search, how COVID kills you, you get a whole list from all different sources about this stuff. Here's another guy, says he's a surgeon, yet the background looks fake. I don't know. You've got to find one that gives you facts from sources you can search out. In this case, we're going to use National Geographic. They give sources and doctors' names that you can actually search, that you can look up, that you can find papers they've done on this, because they all do papers on this stuff. So I'm going to link this particular one in the description. You saw what search criteria I used. Do your own search and look at this stuff for yourselves. Because it doesn't make any sense that we've got people that are perfectly healthy that catch it and die. Then we got people that are deathly sick that catch it and die. But then we have people perfectly healthy that catch it and nothing happens to them and they don't show symptoms. And people that are horribly sick that catch it and nothing happens to them. Why? Well, there's a reason why, and that's why you've got to look at this stuff. Here's what coronavirus does to the body. Like I said, I'll link this in the description because we're only going to read a little bit of it. From blood storms to honeycomb lungs. Here's an organ by organ look at how COVID-19 harms humans. Now, this is from February 18th. So this is back, this technically wasn't even at the beginning of it. The beginning of it started October 2019 when it really started to kick up. So this actually had been around for like 5 months before it got really bad. Much remains unknown about the novel coronavirus ripping through China, but one thing is certain. This disease can cast a storm over the whole human body. Such has been the nature of past zoonotic coronaviruses. This coronavirus isn't a singularity. Actually, your common flu is caused by a coronavirus. Not the coronavirus, a coronavirus. Coronavirus is just a generic term for these different types of viruses. COVID-19 is a specific term for that particular one. There's H1N1 is a coronavirus. H5N8 is a coronavirus. SARS is a coronavirus. Ones that hopped from animals to humans, like SARS and MERS, those are both coronaviruses. Unlike their common cold cousins, coronaviruses, these emergent coronaviruses can spark a viral-induced fire throughout many of a person's organs, and the new disease dubbed COVID-19 by the World Health Organization is no exception when it is severe. COVID-19 stands apart in that in itself it doesn't hurt you. It causes issues, but it doesn't kill you. It's all the secondary problems that kill you. Whereas some of these other ones, it's the primary cause of your illness or your death. COVID-19 works differently. That helps explain why COVID-19 epidemic has killed more than 1,800 people, surpassing the SARS death toll in a matter of weeks. While the death rate for COVID-19 appears to be a fifth of SARS, the novel coronavirus has spread faster. And it's spread because it's so easy to get. That's why they designed it that way. It's a bioweapon. They designed it to be spread super easy. You get all these people that are coming online saying, oh, it's a lie. It doesn't live on surfaces for 5 days. No, it doesn't live on surfaces for 5 days. It does for 9 hours. That's why you've got to spray things down. That's why you've got to clean things. That's why you need those wipes. Oh no, they're over there. Clorox wipes, Lysol. You don't need bleach. Clorox wipes and Lysol do just fine. But you got to clean stuff up, especially if you're coughing and sneezing. That's why it's so dangerous to go to the stores, because people who are sick are going in there coughing and sneezing on everything. You come by 9 hours later and pick it up, your chances of getting coronavirus are very high. Confirmed cases rose to more than 60,000 last Thursday, nearly a 50% jump relative to the prior day. Now notice the number they gave. Now you remember in March, remember how small the numbers were? They were lying about the numbers. And the tally has since increased by another 13,000. This leap reflects the change in the way Chinese authorities are diagnosing infections instead of a massive shift in the scope of the outbreak. Rather than wait for patients to test positive for the virus, diagnoses now include anyone whose chest scan reveals COVID-19 distinctive pattern of pneumonia. There's a secondary infection associated with this disease. It attacks the main organ you need in your body, which is your lungs. Pneumonia is a natural and most likely the progression from having COVID-19. Now, you can catch COVID-19 and never show a symptom. Doesn't affect your lungs, don't get pneumonia, perfectly healthy, everything's fine. You go into quarantine, you come in, I feel fine. But you're not actually fine. You have it. It just didn't affect you negatively that much. Some people are healthy enough that it doesn't. But then again, there's some people that are super healthy that all of a sudden they get pneumonia and die. There's so much misinformation out there that you have to go do your research on this. You cannot believe somebody's YouTube video. Don't even believe mine. That's why I'm linking you to the information. Go look it up for yourself. There's a lot of people that are claiming to be healthcare professionals that are putting out lies, making it out like life is normal. They're all lying to you. Go and do your own thing. When, like right now, our county is under stay-in-place orders. Almost all of Texas is under stay-in-place orders. But nobody cares. Oh, I should be able to do what I want. I need to satisfy my desires. I don't care about anybody else. That's why I haven't left my house in almost 2 weeks. I have to go to the store today, unfortunately, but it is what it is. I'm actually feeling a lot better now. I'm still kind of drug out and tired, but I'm feeling a lot better than I did last night. I was exhausted last night. Too much stuff to deal with. So it says there's a honeycomb effect. You're going to see a picture of it. This method will hopefully allow authorities to isolate and treat patients more quickly. If this outbreak continues to spread, there's no telling how harmful it could be. Well, we saw it. From February to now, it's a bit bad. A leading epidemiologist at the University of Hong Kong warned this week that COVID-19 could infect 60% of the globe if left unchecked. That's a lot. On Monday, the Chinese Center for Disease Control and Prevention released clinical details on the first 72,314 patients diagnosed through February 11th. That report shows that COVID-19 killed 2.3% of patients, meaning it is currently 23 times more fatal than the seasonal flu. Severe disease and deaths were reported in every age group except kids under 9 years old. Now, since then, several younger kids have gotten it. Meanwhile, countries have been scrambling to evacuate their citizens from a cruise ship that's been quarantined off the coast of Japan. The Japanese Health Ministry announced Tuesday that an additional 88 passengers of the ship were diagnosed with COVID-19, bringing the total to 542. Of the more than 300 Americans who have been repatriated from the ship, 14 have tested positive for coronavirus. Remember the last little group they took off that ship? They had them there for almost a month. Remember the last little group they took off? All y'all are clear, let's go. And there was a bunch of Jewish people there too. All y'all are clear, you're going back home. By the time the Jews made it to Israel, they were all sick. By the time the other people they took off to put on the plane to fly them to Cali, because they had a big center there they were running everybody through, before they even made it to the plane, they all tested positive. And they flew them there anyway. That's how bad this thing is. But yet we've got people saying that it's fake. Okay, give me your name, give me your credentials, so I can go prove who you are before you tell me it's fake. Because I'm seeing with my own eyes here in my county where I live the effects of this, and how many people have died from it already. How is it fake? Well, it's not fake. It's because they're trying to create a narrative based on no understanding and no research and no knowledge of the current narrative. They won't go and they won't read up on this thing and won't find out what's going on with it. Guys, the coronavirus is very real. Let's go a little bit more and then I'm going to explain something. Put it in real world terms. But what actually happens to your body when it is infected by the coronavirus? The new strain is so genetically similar to SARS that it has inherited the title SARS-CoV-2. So combining early research on the new outbreak with past lessons from SARS and MERS can provide the answer. The lungs are ground zero for this disease. Now, because I want to go down to the part where it shows that scan of the lungs. For most patients, COVID-19 begins and ends in their lungs because, like the flu, coronavirus are respiratory diseases. They spread typically when an infected person coughs or sneezes, spraying droplets that can transmit the virus to anyone in close contact. Coronaviruses also cause flu-like symptoms. Patients might start out with a fever and a cough that progresses to pneumonia or worse. Find out how coronavirus spreads on a plane in the fastest place, or safest place to say it. After the SARS outbreak, the World Health Organization reported that the disease typically attacked the lungs in 3 phases: viral replication, immune hyperreactivity, and pulmonary destruction. Not all patients went through all these phases. In fact, only 25% of SARS patients suffered respiratory failure, the defining signature of severe cases. Likewise, COVID-19, according to early data, causes milder symptoms in about 82% of cases, while the remainder are severe or critical. Typically, those are the ones that die. Look deeper, and the novel coronavirus appears to follow other patterns of SARS, says University of Maryland School of Medicine Associate Professor Matthew B. Fryman. You guys see there's links and there's people in here we can go reference and prove this stuff. Not all these other people's videos. I'm a surgeon. Okay, well, what's your name? Where are your credentials? What hospital are you working? Oh, they can't give out their information. They're going to get fired. Well, then they need to do a better video. Matthew B. Friedman, who studies highly pathogenic coronaviruses. So we have a specialist. In the early days of an infection, the novel coronavirus rapidly invades human lung cells. Those lung cells come in 2 classes, ones that make mucus and ones with the hair-like batons called cilia. And cilia they align your bronchial tubes, and it's like little fingers. And what they do is they pull the mucus and help you expectorate that stuff. All right. Mucus, though gross when outside the body, helps protect lung tissue from pathogens. Make sure your breathing organ doesn't dry out. The cilia cells beat around the mucus, clearing out debris like pollen and viruses. Freeman explains that SARS love to infect and kill cilia cells, which then slough off and filled patients' airways with debris and fluids. And he hypothesizes that the same is happening with the novel coronavirus. That's because the earliest studies of COVID-19 have shown that many patients develop pneumonia in both lungs, accompanied by symptoms like shortness of breath. So imagine those little things are all moving in there and they're pulling the mucus and the dirt and the debris. It's a natural filter, pulling it out for you to cough it up and get rid of it. Those things die off. Those things slough off and all that mucus goes back down into the bottom of your lungs, which is where pneumonia starts. Fluid in the lungs. Now you have a dry cough and there's pain up here, just like every coronavirus patient. Almost every one of them has that symptom. Dry cough. There's nothing coming out. It's because it's in the bottom of your lungs. That's when phase 2 and the immune system kicks in. Aroused by the presence of a viral invader, our bodies step up to fight the disease by flooding the lungs with immune cells to clear away the damage and repair the lung tissue. Ironically, that effect adds more fluid to the lungs. When working properly, this inflammatory process is tightly regulated and confined only to infected areas. But sometimes your immune system goes haywire, and those cells kill anything in their way, including your healthy tissue. And it's because they're going for the coronavirus. So they're going throughout your body because it's throughout your body. So they attack everything. Now there's something unique I'm gonna add at the end of this because there's certain people that this is really terrible for. I'm one of those in that issue. So you get more damage instead of less from the immune response, Friedman says. Even more debris clogs up the lungs and pneumonia worsens. Find out how the coronavirus compares to flu, Ebola, and other major outbreaks. During the third phase, lung damage continues to build, which can result in respiratory failure. Even if death doesn't occur, some patients survive with permanent lung damage. Remember, we talked about that. They have a bunch of people in Wuhan that have been clear for a month, took them back in and CAT scanned them, 20% lung damage across the board. According to the WHO, World Health Organization, SARS punched holes in the lungs, giving them a honeycomb-like appearance, and these lesions are present in those affected or afflicted by novel coronavirus 2. Now, there's a little video here, so I'm going to link this in the description so you can watch it yourself, but it shows you how this thing works. Okay, so I'm going to stop there. You guys can click on this link and go read this for yourself and get more information. So imagine like this. You're perfectly healthy, in your mid-30s, nothing's wrong, everything's good, you're out running, working out, everything's completely fine, strong respiratory system, no issues. You catch coronavirus. You may not even know you got it. You may get a little cough. Talk to the doctor. Or maybe you go in for routine blood work. Hey, you've got coronavirus. Really? Yep. You go on quarantine. Come out of quarantine, everything's fine. Same person, different scenario. Perfectly healthy, everything's fine, but there's a little bit of diminishment or diminish in their lung capacity. They get it. Okay, got a little issue there, things are going on. The immune system goes ballistic trying to kill it because it's throughout their body. Maybe they were out pushing themselves too much. All of a sudden, their lungs fill with water. Now they pop up with a bad case of pneumonia. Not only do they have the coronavirus, they now have pneumonia. They start fighting that ammonia, get a Z-Pack, get some hydroxychloroquine. It all clears up, they're good to go, everything goes back to normal. Same person, different scenario. They have respiratory issues. They suffered from childhood asthma. There's already damage in the lungs. There's already nodules and scar tissue in the lungs. Introduce the coronavirus. Instantly, they get pneumonia. Instantly, they start having problems. But instead of them being able to expectorate that stuff and cough it up, it goes down into their lungs because all those cilia die. So now they've got a half a lung full of fluid. Now their immune system kicks in. It's already been working overtime, keeping up with the asthma and fighting anything that gets into the lungs that way. Now it has to try to fight this. So it goes into maximum overdrive and it starts trying to kill this thing. Well, it adds even more liquid to there. Now this perfectly healthy 30-year-old who had childhood asthma dies. And it wasn't because of the coronavirus. It was because of the secondary infection they got that their body couldn't fight. See how it works? The coronavirus doesn't kill you. It is 100% real. It doesn't kill you. It's the secondary issues that kill you. Nobody has died from coronavirus. They die from pneumonia. They die from bronchitis. They die from their respiratory shutdown because the organ just can't do it anymore. It just shuts off. Now, take somebody like my mother-in-law, for example. She only has about half of her lungs working. She's always got this stuff coming up because her lungs are gone. She catches it. She might have days because she already has lungs full of fluid. So now you have a pre-existing health condition in an otherwise healthy person. That adds 10 times to the problem. So if you have a pre-existing condition currently and you catch it, it's even worse. Let's say you have bronchitis and you go to the store, you got your mask on and everything, but then you get a can, you get it, and you get coronavirus with bronchitis. You're probably going to die from it. Your chances are very high because now you already had a respiratory infection. Now you've introduced another one. And now this one's probably going to cause pneumonia to kick in. So now you'll have bronchitis and pneumonia because you've already got lungs full of fluid. Your immune system's going ballistic because it doesn't know what to do because there's so much stuff going on. That's what people are dying from. That's what's killing people. It's not the virus itself. It's the other effects that the virus opens you up to. Now, go back to that perfectly healthy person with no issues. They catch it. They've never had anything in their life sick. Their body hasn't had to fight none of this stuff. They're opened up to the possibility of pneumonia. All of a sudden, they catch it. Now, because their body has never had to fight this before, it doesn't know what to do. They get them on treatments real quick. trying to help them. This perfectly healthy person could die from this because their body's never had to fight this. Well, now because of the coronavirus, it's been introduced into their system. They're now open to this type of infection. Normally, our bodies can fight this stuff off. When you introduce coronavirus into the lungs, now your body has a hard time fighting off these bacterial infections. So it creates a situation for you to catch something much worse. It's not the coronavirus itself that kills you. You go read the rest of this article, you'll see. It's the secondary infections. It's the other stuff that comes up that kills you. Now, there's a very unique group of people out there. I'm one of them. Where we had, through whatever it was that happened, in my case it was a bad batch of anthrax vaccine, some experimental stuff that I had gotten exposed to. Other people, it may be other things, where our immune systems were already in hyperdrive. And so, since it had nothing to fight, because it killed everything in our body, it started to attack us. My particular situation is it attacks the connective tissues, the tendons, the ligaments, the soft tissues that lubricate them, the sleeves that they all slide in, they swell up. I got fluid in my wrist and in my elbow. That's where my issues come from, because it's attacking those things. Ironically, my organs are connective tissue. All your organs are connective tissue. So it's attacking those too. And it's slowly eating me alive from the inside out. Even the little layer of fat that holds your skin on, it's attacking that. So my skin's starting to look bad because of it. So those of us that are suffering from that particular type of situation, where we already have an overdriven immune system, we're taking medication to suppress our immune system. We can't take massive doses of vitamin C. We can't eat garlic. We can't do anything to make our immune system stronger, because we're taking stuff to make it weaker to keep it from attacking us. And I got people giving me all this advice. Oh, you need echinacea tea. You need vitamin C. You need vitamin D. Well, I already take vitamin D because my body won't hold it. I take a multivitamin because my body has leached out of all the other stuff from the other chemicals I'm putting in there for these medicines to suppress my immune system, to keep it from eating me alive quicker. Trying to add some. They're just basically helping me stay alive longer by doing this. There's no cure for what I have. And many people have the same thing I have. There's papers being written on this. We can't take those things that everybody would normally take. So now, somebody like me, I'm not sick, but I have a health issue that opens me up to a much worse problem. Introduce coronavirus. Now what happens? I already have messed up lungs from this. Everything else is messed up. I'm probably going to die from it. I might get lucky and get a week. That's how this thing works. That's who it's killing. That's why you've got a lot of old people in their 60s pop up with this stuff and die within a day or two. Their system is already shut down. It can't fight anything against this. A perfectly healthy person who's never had any major health issues, fight it just fine. Might not even know they got it. That's the other danger. That's how easy it spreads. Because that person walking through the store perfectly healthy has coronavirus but doesn't know it because they're healthy and has those symptoms and coughs and a little drop hits a can. Next person comes up behind them, grabs that can and gets that on them, and they got coronavirus. That's why it spreads so easy. This is why you have to exercise caution and take proper precautions, not only to protect you from getting it, but in case you have it, keeping you from giving it to other people. Because you can have it and never even know you have it. They had people in Wuhan that were like, well, let me go get tested just to make sure, because they were testing everybody across the board. They'd go in, they were like, hey, you had it. Your body's already fought it off. You had it. What? Yep. So while they had it, everybody they came in contact with, they were infecting them with it. And they were making people stay in their houses completely. They were bringing them groceries, so they couldn't leave. So that means everybody in the place got it. So you got to got to check the facts on this stuff. All these people putting up these videos saying, well, I'm a healthcare professional. Okay, what kind of healthcare professional are you? And I'm telling you guys, I'm at work right now and I'm looking at it, and this isn't what people say it is. It's all lies. They're lying to you. If they can't prove who they are and they can't show you medical facts, they're lying to you. Do not believe what they say. They want you to come out from under this going, I should be able to do what I want to do and go ahead and go anyway. Then you're going to make yourself sick. Now, these are stupid people. These are people that get joy out of fooling other people. And they think it's funny. But they won't think it's funny when it happens to them. They won't think it's funny when something goes wrong in their lives or one of their loved ones gets sick and dies from it. See, not everybody has been personally affected by this. Many of us have. But whenever we hear somebody going on, it's fake, it's fake, it's fake. I know how to read. I know how to research. I'm giving you guys a small taste of the research that I've already done into this. And there's a lot of other people there. Well, you need to go research this. I already have researched it. You're not telling me anything new. I have personal experience in this. My brother still has health problems from this. He's still struggling. Even though he's off quarantine. Which doesn't make sense to me, but
14 days.
So check this link out. Use the search criteria that I gave you guys. Get up there. Go into Google or Bing, how COVID kills you, and just start looking through the stuff. But you've got to prove everything. You can't just take what somebody who's dressed in a shower cap and a paper outfit that you can buy at Home Depot for painting and a paper mask that you can get anywhere. Any hardware store carries masks. Anyone. They use them when they're doing drywall. You can't believe everybody that tells you that's dressed like that. You can't believe them. You can't believe somebody who's wearing a scrub top or even a scrub top and bottom. Some people wear those around their house because they're comfortable. You can buy them anywhere. I can go to Walmart and buy scrubs. So you can't believe somebody who says they're something and makes it look like that, but they don't give you any credentials and don't give you any facts. You've got to go look for the facts. But see, this is causing a big problem because now a lot of people are getting a false sense of security. And that my worry is, and why I'm doing this video, is that there are people that are getting this false sense of security that are going out there and exposing themselves to something and then coming home and exposing people in their house who do have health issues. But they're thinking they're good because they're basing it off these other stupid people's videos. You cannot believe what these people say. You've got to test everything. Every time I run across one of them videos or somebody links me to one of those videos, I ask the questions. What's this person's name? What are their credentials? What hospital do they work in? What have they seen? How can I verify? What are the facts? Then I start picking apart and attacking the background. Why is that apartment so small? I don't know any doctors that have an apartment that small. Why are the cabinets all broken in this place? Why are there? You ever gone to a nurse's station? Looked at all the stuff they got stuck on the cabinet doors? And I'm looking at a video and this person's talking like they're they just say, I'm a healthcare professional. Didn't say who they were. Nothing on the cabinets. This place literally is just whitewashed clean. I don't know any place like that. There's always stuff hanging all over the walls. Supplies everywhere, all kinds of stuff, yet they're sterile in the background. Then they got their hair all hanging down in the front. They don't allow you to do that. Little details like that tell you that these people are lying. That what they're telling you is fake. And they're doing it because they think it's funny. But then when somebody they know gets sick, it'll be a whole different story. So guys, make sure you're checking this stuff. Make sure you're digging into the details on this. I'm helping you by giving you a video and showing you where to go find the facts at. Go learn the facts about this. Because when you know how this works, you know how to protect yourself. Don't take what somebody else tells you for granted. Especially me. Go prove it. See, they won't link you to things that you can go prove. It'll be a description with nothing in it. You need to go prove this stuff. Because, like I said, anybody can pose as a doctor. Anybody can pose as a nurse. Anybody can pretend. If you notice this guy in this picture right here, that suit that he's wearing, you can't buy that at Home Depot. Notice you can't see through it? But yet some of these other people are wearing those thin paper ones and you can see through it. You can buy that anywhere. So do your due diligence. Do the work. Search this stuff out and get the facts so you know and you're armed with the right information. Because if you're not, you're hurting yourself and anybody around you that this may affect very negatively. And you're going to feel terrible if that happens. So anyway, love you guys. I hope this helps, and I hope this directs people to the right way to be able to tell what's going on here and to know what the facts are on this and to not take any of this stuff for granted, because this is a pretty serious situation. And the reason why it's spreading so fast is because people aren't heeding the warnings. They're not doing what they need to do. Like right now, I'm the only other one in my house that goes to the store, and it's only if I have to. And I don't even go to other people's houses. My wife does all that stuff because she has a travel pass for our county. So think about it, guys. Don't believe other people. Take the time. Do the research. I'm putting this out to help everybody because there's a lot of lies going on out there, and they're dangerous, and it can get you really messed up. See you guys in the next one.